Thank you for joining us for today's roundtable sponsored by Cognitive Systems with Connected Health Summit here. We are talking about the demand for senior assistive technologies and in particular, the role of ambient sensing as a new frontier in senior care. Thank you so much for joining us. We hope you will gain a better understanding of what expanded care at home for seniors includes and new opportunities to serve this important and growing market segment. Jennifer Kent, Vice President of Research with Parks Associates, and so pleased to be hosting this conversation today. A big thank you to Cognitive for sponsoring this roundtable today. Appreciate your support for hosting this conversation, and also thank you to all of our sponsors who have made the Connected Health Summit series of conversations possible this year. So thank you to Cognitive, to Beckler, to Alarm.com, Calix, and Silicon Labs. We really appreciate your support. We find these conversations to be really engaging and hopefully helpful to those of you who are trying to understand what's happening in the senior technology market. Again, hope these conversations are helpful, and thank you to our sponsors. So I'd like to introduce our panelists. We have a rich mix of industry leaders and innovators on this panel today. We're going to be hearing from Megan Fitzpatrick, the Vice President of Product at Lifeguard Health, Mark Francis, the Chief Product Officer at Electronic Caregiver and also in the Forbes Technology Council, Taj Manku, who's the CEO and founder of Cognitive Systems, Eliza Salerno, the Chief Operating Officer of Medical Guardian, and you'll get to know them a little bit deeper here in just a few minutes. And all of these panelists will be taking on a variety of topics in our discussion, including how seniors, caregivers, health service providers are seeking more advanced monitoring solutions to help balance safety, independence, and dignity beyond just an alert that something is off or something is wrong, or of course that emergency situation. Also, how to build trust in the technology, especially as we see devices, sensors, systems, algorithms continuing to get more and more capable each year. And also what business opportunities are emerging because of new and advanced tech like ambient sensing being integrated into solutions. So I wanted to start off by sharing a little bit of Parks Associates research. We just published our newest study on senior assistive technologies last month, actually, where we surveyed consumers in U.S. internet households. We survey 8,000 U.S. internet households every quarter, and we really focused on those who are caring for an older loved one. And we've done this survey for several waves now. You can see going back to 2019, this data asking consumers to identify themselves. Are you caring for another, for an older adult? That could be a spouse, right? You may be an older adult yourself, could be a spouse, could be that you're a kind of adult child and caring for a parent, could be a sibling, you know, any sort of relationship there. And what we've seen over the years is this slow and steady climb of the number of people in the United States who are telling us that, yes, they are engaging in caregiving. So 10% in 2025 of consumers in U.S. internet households telling us that they care for an older adult currently, and 16% saying that they anticipate that they will be caring for an older adult within the next 5 years. So we only continue to see this market and the demographic and the size of the market that these technologies are applicable to just growing. And we know that, of course, tracks the demographics of the country as a whole. At the same time, we also are seeing the number of these households who are telling us they are using technology in that caregiver role, of course, alongside other things like actual staff to the home or meals being served, et cetera, right? There's all sorts of tools that you kind of, and services that you have in your toolkit as a caregiver. But those who are using some sort of assistive technology continuing to rise as well. So 16.3 million US internet households using assistive technologies for caregiving today, up from 14.4 million households in 2022. So just in those 3 years, we're seeing that growth. And it's a variety of technologies. It's not necessarily just one thing. So people are using PERS, so a medical alert or panic button type device, smartwatches, a mobile SOS app, sensor-based systems that can understand movement and activities of daily living in the home, fire safety, smart connected smoke detectors, stove and oven shutoff valves, knowing that fire is a particularly big concern and risk for the older population, smart home devices, video devices, smart door locks to allow people to come in and out of the home, smart speakers and displays, even TV-based systems, and of course the services that go alongside that, for instance, even professional monitoring that may be attached to one or more of these types of solutions. So definitely growing population, growing market, and also growing use of technology to support people in that role. One other thing I thought was interesting in our study this year that I wanted to share was the idea of bringing forward to consumers a package that they might be interested in, that's a technology package to help them live longer in their own home, for instance. This could be somebody living in their own home, but also even somebody living in a community, right? Like a 55 plus community, or independent living, as you kind of get up the sort of acuity scale there when it comes to community living, that you could subscribe to an amenity package of devices that would both, add some safety and security and convenience to your home, but also really help in, again, helping you live well and age well and independently and get that help if you need to. So for instance, including a doorbell and locks and a smart thermostat, as well as a smart stove sensor, fall or incident detection with the ability to call for help automatically, and wireless sensors that, again, detect if someone or something is off in the home. And we definitely saw some interest actually across age groups, but focusing just on the 55 plus respondents. The level of interest at the various price points that we tested equated to essentially a $5 billion annual market opportunity, assuming that these are kind of an ongoing service. So just in 1 year, and just in the interest levels today, $5 billion market opportunity. So growing market, growing use of technologies, and certainly a growing opportunity for businesses in this sector. So we're going to be, tackling some big questions, and really the industry is facing some really big questions right now. What do seniors actually and caregivers want? What do they need? How is technology transforming that care at home? How does ambient sensing enhance care and response and play well with other types of technologies that are being used? How can new models be scaled to meet rising needs? How to balance the human touch with automation. So there's absolutely still a role for that as these technologies become more and more used. And again, those algorithms and the intelligence get smarter. Where's that role for the human touch? And of course, what will consumers pay for, and how do you communicate that value? So with that, I'm very excited to be diving into our conversation. First, I'd love to turn to Taj to tell us a little bit more about cognitive and the technology and solutions that you offer.
Great. It's nice to be here. Thanks, Jennifer, for that. So I'm Taj Manku. I'm the CEO and founder of Cognitive. I've done a lot of stuff in the wireless industry, but one of the things that we're focused on is specifically using Wi-Fi for motion detection for caregiving. And we're not new in the ambient space. We are already doing this, and we have like 19 million of our pieces of software. And we were focused initially on the ISP market. And then we now are moving into the caregiving market because we think we fit really well with this, just because the economical scale of Wi-Fi, it's everywhere. And with Wi-Fi, we can actually sense movement of people moving around, and then we sort of make those movements into features or valuable insights. And for the elderly care market, we focus on things like, knowing when they're sleeping, when they're waking up, are there any interruptions? Have they woken up? So that's the first motion detected, real-time insights, knowing if they left the house, inactive periods, like if it's unusual for them to be inactive, we will notify that, and just daily summaries. And one of the important things is just trending. So just understanding how things are behaving, or is their sleeping going down in terms of the time that they're sleeping, or is it going up? Are there more interruptions? Are they moving less around the house? And with those insight, it provides you how they're doing in general. And it is just using Wi-Fi signals to able to sort of detect the motion of these people and providing these things. So we have a small video that sort of shows how this technology sort of comes together in terms of the features it provides. So for us, we basically have a complete solution. We have an app, we have APIs, we even have hardware, which is pretty inexpensive. And these are some of the features that I just recently discussed that are again, it is just using ambient sensing. So one of the big things is sleep monitoring. My parents are in their 80s, and I use that a lot. I also first motion detection. I know when my parents have woken up. I get a lot of insights. I can actually monitor them. Are they moving around right now or not? Have they left the house for an appointment? So this is all encompassed within the application or the APIs there. An important one is just, are they not moving around anymore? And the big one is the long-term trend. Just really understanding, are things going badly or are they pretty much good? There's a bunch on the daily summaries telling you how that's going for your loved ones. So that's our solution.
Awesome. I'm so glad that we got a chance to actually see that video and play that video, because I think it really does give a demonstration for all of us to think about how those notifications come through and what the different activities during the day, and kind of see it live. So thank you for sharing that with us. Okay, now I'd love to go around the horn and ask the other panelists as well to introduce themselves and tell us a little bit about your organization and how you fit into the larger ecosystem. I'm going to start with Megan. If you could go ahead and tell us a little bit about yourself and about Lifeguard.
Thanks, Jennifer. Hi, everyone. My name is Megan Fitzpatrick. I am VP of Product at Lifeguard. So at Lifeguard, we use ambient sensing technology to, help seniors live independently at home for longer. And, our customers, home care agencies, retirement communities, individuals, what we do is we provide them a wraparound service. So we're going to take care of the installation, the monitoring, as well as the reporting. And there's two important parts of our offering. So we offer a 24/7 safety monitoring piece, as well as a nurse-led wellness and reporting piece. And I think an important differentiator about our service is that, even though we're leveraging, the ambient sensing kind of to drive the whole solution, we do have a human component into it in the alert center and the reporting that we do. So yeah, that's a bit about us.
Okay, great. Thank you for being here.
Thank you.
We also have Mark Francis. Mark, tell us a little bit about Electronic Caregiver.
Sure. Mark Francis, Chief Product Officer, Electronic Caregiver. Thrilled to be here. We are an NIH-funded digital health technology and services company. Where we focus is we develop what we consider to be the most engaging and intelligent platform to deliver virtual care and support aging in place. Kind of our areas of differentiation, we've developed a virtual caregiver by the name of Addison, who's really focused on developing a relationship with an end user, addressing social isolation, loneliness, which then leads to much more compliance with care plans and medication. We then look to augment that with ambient sensing technology, including a relationship we developed with Cognitive Systems that we're quite excited about. We serve the Medicare, Medicaid, aging in place market. And we, on a daily basis, we process about 2.5 million pieces of data per day that we run through our data engine and our AI algorithms to develop, actionable insights to providers.
Okay, fantastic. Thank you for being here as well. And Eliza, tell us a little bit about yourself and about Medical Guardian.
Yeah, thank you so much, Jennifer, and thanks for having me. I am Liza Salerno. I'm the Chief Operating Officer at Medical Guardian. We are a connected care company focused on helping older adults live independently and safely at home. Our solutions range from advanced wearable devices to innovative digital solutions for engagement, safety, and predictive health. We serve 625,000 members in the consumer, healthcare, and senior living space. I'm thrilled to be here with the rest of the panelists. Thanks for having me.
Okay, fantastic. So let's dive into it. And I always love to remind the audience, you do have a questions tab here, and we would love to take your questions. I'm so glad to see so many of you on here today. And so we love this for, to be engaging and answering the questions that are top of mind for you. I already see one coming in, and it's about the parks data. So I'll just answer it real quick, and then we'll dive into the conversation, which is how much of the parks trends correlate with the rising demographic of seniors. So kind of two thoughts there. One is definitely as the demographic, grows, that pushes the numbers up of users, right? So yes, some of the growth that we're seeing is just the fact that more people are aging into this demographic and are expanding, but also importantly, you have some seniors aging into that demographic who are quite tech savvy, right? Who have even been using for smartphones for years, who may have already had, some sort of smart home technology, for instance, even in their home, a smart thermostat perhaps just to start. And so maybe more open to thinking about how to use technology in your life. Usually the first step is that smartphone, of course, and definitely their caregivers being more tech savvy and starting to think, how else can I use these devices in my life? But I'd love to start actually to use that to turn to the panelists just to really start there. Megan, I'll start with you in the seniors, the communities, the caregivers that you're working with today. What are they asking for? Are you seeing an increase in demand?
Yeah, definitely. I mean, I think one of the biggest concerns is, what is happening in the home when the senior is by themselves, when there's nobody there. So when there is no caregiver present, is the person safe? Are they keeping up with all of those activities of daily living that we want them to be in their best health? Are they eating? Are they sleeping? Are they, going to the washroom? Are they, keeping up with their hygiene? So just wanting to have a better picture of if all of those things are happening. And I think the concern is that, as individuals, when we see someone, we're not always attuned to the small changes that happen. So wanting to have something that's going to help clue people in when things are maybe going in the wrong direction, that might take a real human interacting with someone else a little bit longer to notice on their own.
Are you seeing more interest in the because a lot of what we know to be true in the senior market is senior care market is oftentimes it's reactive. Something bad happens, right?
Yeah.
There's a fall, there's a medical issue. And so now it's like, oh, there's been an emergency, we need something. But also there's new opportunities from everything that all of you are offering really to be more proactive. Are you starting to see any of that shift or more interest in the proactivity, Megan? And then I'll come to you, Eliza.
Definitely. I mean, a lot of the customers we work with are home care agencies, so they're providing the caregivers to the senior, and I think they definitely see a big opportunity to be able to, make sure that the care they're giving that senior, the services that they're offering are the optimal ones to kind of help support them. So if it looks like maybe they're not able to keep up with certain things, they can offer those services to try and, as you say, be there and keep them healthier to prevent those other incidents that could occur.
Yeah. Eliza, what are you seeing from Medical Garden's point of view and kind of the offerings that you guys have in growth and demand, or is it sort of changing what people are looking for?
Yeah, absolutely. I would echo, some of Megan's sentiments. I think, the cost of care and the desire for care in home is certainly on the rise. I think all of us understand that. And people want to know that things are happening with their loved ones as early as possible because, early intervention really drives, cost of care down for systems, consumers, caregivers across the board. So I think people are evolving their perception of what, people in our space should offer so that it's, competitive with the data and innovation that exists in other consumer goods spaces. And so with that, I think, people are looking for solutions in the home to know that their loved ones are safe or know that their population is safe or know that their facility is safe. but as well, understand from a data perspective where things will be. And so I think predictive analytics, behavior trends, things like that are certainly on the rise, and we're all providing solutions, I think, that are conduits to being able to facilitate better care through those solutions. So certainly I think we're seeing a industry change of expectations for sure.
Quick follow-up there, and then I'll go to Mark. So, there's various ways to get these kind of solutions to market. There's direct to consumer, there's through another provider like a home security system provider perhaps, or through home care agencies. Can you talk at all about, the channels that you guys are offering, if there's any kind of expansion there, or, different opportunities or requests that you're seeing through, whether it's, again, direct to consumer or starting to get interest among other folks, who could use these technologies?
Yeah, absolutely. I think, technology and devices in the home are on the rise from every segment. So we serve consumer, healthcare, payer and provider segments, facilities, and a broad spectrum of other partnerships for companies or health systems or payers that are looking for solutions that allow them to know what's going on every day. It's very unique to be able to have a everyday in the home ability to understand how someone's aging, how their health and wellness is progressing. And so I think other industries, and even, our industry, certainly healthcare, consumer and senior living, are all doubling down, I think, on the benefit that they see from being able to provide real-time data and real-time insights into how people are doing, whether that's, I want to know how my mom is feeling and if she's adhering to certain regimens and engaging with her products and solutions regularly, or I want to look at my entire population and positively impact the way they age to, provide cost savings to the health system, but also take, more targeted approaches. I think that's a really unique space, is not having to look at your population as a whole anymore, really being able to use data to segment cohorts and provide really tailored solutions that are, better aligned with each group of cohorts' needs. And I think devices like ours give systems and payers and providers all the ability to certainly understand large populations and how they're doing, and then subsequently, it's also our responsibility then provide those solutions on how we can further impact beyond just, safety and emergency care, but really health, wellness, proactive care. And so I think, all industries, all segments are certainly, like I said, doubling down on what they're expecting or what they're looking for. And so, at Medical Guardian, we have our products are available to all of those segments, and we work in all of those segments. So I think we're all going to be required to provide solutions that, cross all of those areas.
Yeah, and Mark, maybe you can weigh in here too. You mentioned in your introduction about serving Medicare and Medicaid populations and having these relationships. And can you talk a little bit about what is being asked? Like Eliza's saying, more is being asked of what you can deliver. What are those types of partners kind of looking for?
Yeah, great point so far, Megan and Eliza. Really good discussion. What we're seeing across the different sectors are folks wanting solutions to be accurate and the information to be actionable. One of the biggest ways to lose trust and lose a relationship is if you overwhelm folks with data for data's sake, and then it's put on them to do something with it or figure out what to do with it. So being able to curate that data and present up to folks information that is actionable for them and their role as a provider, and that varies depending on the type of provider, is really, really important. What we've also seen is a shift, particularly in the home care industry over the last probably 3 years. Home care is a business built around putting bodies in homes. That's what they've done. So when technology started coming to them, you'd get like a stiff arm from them. I don't want to do this. It's competitive, which it wasn't, because it augments them, but that was the reaction. Now what we're seeing, because of a shortage of family caregivers, a shortage of professional caregivers, a lot of churn with professional caregivers, the realization that I need to embrace technology that's going to augment my caregivers, make me be able to allocate that scarce resource as effectively as possible, and then also to be able to be eyes and ears for the client I'm providing 24/7 when we're not there. So I see a lot more acceptance of that now than we've seen before, and now some new business models around that emerging. And part of it is because the technology is now much more accessible. Things like Wi-Fi sensing is, truly ambient. So you now have an ability to get glean some really, insightful insights that are accurate, that complement the work of the care providers.
Yeah, that's great. And just to pick up on kind of your last point there, maybe Taj, you can weigh in on, is that the deployment of Ambient specifically in kind of the wider portfolio of assistive technologies and solutions and services out there. Tell us a little bit about, how things have changed. A lot of the technology, and I mentioned the algorithms are definitely advancing. And so kind of what's the state of ambient sensing in the market right now?
Yeah, so we've been in the ambient sensing market for a while, and as I sort of mentioned, we were initially very focused on the ISP market. So our software is running in a lot of these ISPs, including one of the biggest in Comcast. And it's interesting that over the last 5 years, this technology has advanced fairly fast, mainly because there's a whole bunch of players that are now sort of pushing it. So it's just not us. All the chipset providers that provide Wi-Fi chips are now implementing Wi-Fi sensing into their chip or the interface for it. We're also seeing standardization start coming into play, meaning that the Wi-Fi Alliance, which sort of supports all the Wi-Fi standards, they're starting to now make this part of the standard offering going forward. So the ecosystem is definitely growing, and the algorithms are significantly improved over, let's say, the 5 years. And in terms of what we provide and ambient sensing, we can take this data, which is basically just looking at people moving around, and then really highlighting some interesting key features around that. So analyzing the data that's there and start looking at things like, sleep patterns, the trends, which is really important for proactive, meaning that you could see whether over a course of a month or so, are there more sleep interruptions, and then you can actively address this. But that ecosystem for ambient sensing is growing. And the one thing about Wi-Fi, people say, why did we do it Wi-Fi? Why didn't we use some other sort of standard to go forward? The simple reason is Wi-Fi is very affordable. So what I mean by that is, Wi-Fi is everywhere. We have so many chips out there. In most people's home, they have at least 20 devices with Wi-Fi. So the cost for these Wi-Fi chips is reduced significantly. So for example, now you can buy a Wi-Fi complete module that will even have our motion sensing. You could buy a module for like 60 cents. So why that's important? It also helps with the economics of providing a solution to somebody, meaning that you can provide a very inexpensive solution, but it provides you full home coverage. You basically place it in the house, and now you can actually look at all the various places within the home by using this technology, because like I said, Wi-Fi is everywhere. And then because of that, you can now start, like I said, getting all this information with regards to looking at them proactively. So we're seeing on the ambient sense, specifically Wi-Fi, it's not just simply us sort of supporting it. There's a large ecosystem that's happening, from the chipset vendors to the people who are making the actual pieces of hardware, all the way to the services. And and there's a bunch of folks obviously using our stuff within the elderly care market right now, and we're quite excited about what it can sort of provide to them and really help to save lives and really understand, are people living healthier, or is there a decline? And if there is, sort of take some actions on it. So there's a lot going on with regards to the Wi-Fi sensing industry right now.
Well, those are great points, and especially on the affordability and the proactive trends, actually speak to one of the questions that we came in, and a polling question that I'm about to launch. So one of the questions that came in is, what is the best way to address new technologies with seniors who may not be interested in them or think that they need them? one of the polling questions we were going to throw out to the audience, I'm going to go ahead and do that now while we take this question, is what is most important for assistive technologies for seniors generally to focus on to drive interest among senior and family caregivers? Is it reliability and peace of mind, trust that the system will work if there's an emergency, ease of use, minimal setup, right? There are concerns around, hey, this is too complicated, privacy and dignity for the senior user, which we sometimes see a concern about, especially internal cameras, often being a big concern of using sort of a camera-based solution. Proactive insights, so predictive alerts, health trends, monitoring, and really adding that value or affordability and clear ROI for families. So I think all of these kind of speak to this question, and while the audience gets their answers in, we'll let this stay open for about a minute. Would love to, come back. Maybe Megan, what do you see as the best way to address new technologies with seniors who might not be interested in them or think they need them? Again, sometimes it's like until something bad happens, right? How do you kind of get over some concerns and really communicate that value?
Exactly. I think really, when you're talking to seniors and their loved ones, you really need to focus on the benefits, like what it's going to bring to them. People actually, nobody wants technology in their home for the sake of technology, but I think we have to go back and focus on, why are we doing it? Because of the amazing benefits it can give us, because of, as we've talked about, the safety, the data, the insights, and, just really focusing on why it's important. And then I think that helps people get over. And then I think you have to follow that up with the assurance that, this is discrete technology. This is, private. It's, there's nothing recording me. There's nothing that's, spying on me. So then I think that helps kind of give them a peace of mind that, I'm getting these great benefits, but I'm also not giving anything up because of, Wi-Fi motion specifically, because of the way it works. So.
Yeah, absolutely. Eliza, maybe you can chime in there as well, from Medical Guardian and all the, great end users also that you guys get to talk to or monitor, and, what concerns do they have, and how do you get over that, and what messaging do you feel like really hits home?
Yeah, I think people want to, what we see a lot is people want to know that the company that is servicing them is being responsible. I think that's really important and something that comes up a lot, which is I want you to be responsible with my privacy. I want you to be responsible with my data. I think both of those things are incredibly important for all of us to take a true, obsession with, because as, technology advances, those are really key responsibilities as we deliver solutions into the home. So I really echo what Megan said around building real value, because I think you can miss the mark deciding what people need. I think, uniquely for us, we have, a very big base. And so we're able to have real conversations about, hey, beyond the safety aspect of the devices we're providing, what are the other needs in your home or in your life as you age that are unmet right now? And what value can we provide beyond the PERS device that really solves a true need for you right now as you age, or your loved ones as they, become caregivers? And I think there's a ton of data out there. And I think, I echo everyone's conversation around making sure that data is responsibly used and used to create true value and insights and ease of use. I think we see that you get better adoption when you come from an educated place on understanding what the true need is, what the true value is. And so I think if we serve up great value, if we meet real needs for our members, if we deliver solutions that, to your point on privacy and dignity, that should be at the forefront of everything all of us do all day. And so I think if we do that and we act responsibly with data and privacy and get opt-in and talk to members constantly, I think one of the things that's really popped up for me that I've been thinking about a lot is likely none of us have full-time staff members creating solutions or driving innovation that mimic our exact member. And so how do we make sure that we're communicating with our members all of the time to make sure we're not missing the mark or coming from some bias? We have responsibilities to provide solutions to the Medicaid, Medicare populations. We have responsibility to provide solutions to partners and consumers and caregivers, and those are a lot of different needs. So I think it's about being really responsible, having good, rich data, taking cohorts of data and creating solutions that really solve problems. And so I think once you're able to do that and show a history of doing that, adoption and trust really go through the roof. And so I think it's really just about being diligent in all of those areas.
Yep, and when we're looking at the results of this poll here, so the number one thing is ease of use, minimal setup, which is definitely critical, and then reliability and peace of mind. So that's part of the trust, as well as privacy and dignity for the senior user. They're both, do I trust you as a brand? Are you going to help me when I need it? And then also, are you protecting my data in the right way? And so I did want to kind of talk about this a little bit more. Mark, maybe you can chime in on building that trust, and then we'll go to Taj on that as well. Especially, you've got Addison, she's a virtual caregiver. That might be a very new way for people to interact with technology. How do you build that sense of trust in a virtual assistant?
Yeah, I think there's a couple of aspects here that are really important. Trust is foundational. So whatever expectations are being set with the provider up front, delivering to meet those expectations and or exceeding those are critically important. That trust isn't just the data itself, but the data is going to integrate with other sources of data as well. Needs to make sure that happens seamlessly as well. And then a big part on top of all of that, which we haven't touched upon here, but if you want to have adoption with providers, this needs to fit in seamlessly with their workflows. I think we're going to see in the aging at home space, senior care space, what we saw a few years ago in the clinical space. We were being used, some of our solutions, for remote patient monitoring and chronic care management during COVID. And then about 2 years into it, a lot of our provider partners said, look, we have 10 different solutions for 10 different purposes. None of the data talks to each other. It's siloed and it's a pain in the ass. This isn't sustainable. We need to change that. So when I see some of our panelists here starting to integrate other capabilities or build out capabilities in their solution, that's really, really important, because I think we've gone beyond, if we want to have scale adoption, single point solutions, no matter how good they are, to really data integration and then a single pane of interface for both the professional caregiver and the family caregiver. Because the last thing we want to do is, if there's 4 of us here with solutions, to have a customer open up 4 different apps to be able to get the benefit of everything we all offer. How do you get it down to a single app for them?
Yeah, I think those are great points as well. Taj, would love to have you chime in if you'd like to and I know you just mentioned this a little bit in your previous comments, but on that trust and reliability in the technology too, that it's going to flag the right things and not the wrong things. And part of what Mark's talking about too, the interoperability of the data flows, that they're all going to the right place, simplicity for the care provider. But yeah, how about increasing trust, particularly like in Wi-Fi sensing, and that it's detecting the things that it should be?
Yeah, so I think the trust element is really important, and I think it all comes hand in hand with a couple of items that you've talked about already, right? I think when you're talking about the ease of install, that's where the trust sort of starts, right? You're delivered something, now you got to install it or turn it on or whatever. And it's really important that it does what it says it does, and it's easy to set up, because that's the point where people will decide, hey, this is useful for me or not useful, in terms of, hey, if it's easy to set up, then hey, it actually works and I can see it working. And if it takes them longer or they just can't physically set up, there's just generally a lack of trust in it, especially if they have to get on the phone and try to get to work through it. So at Cognitive, we spent a lot of time and we researched a lot of devices on terms of setup, how they sort of did it. And, we feel we have a pretty good setup right now, but we're always looking at that as a very important improvement in our area in terms of roadmap, always making it easier. And then once you get that trust in terms of getting it set up, yeah, people will ask questions about the privacy nature of whatever they're doing. And that's a conversation that needs to, the person that you're monitoring has to be very comfortable with. And if you're sort of, I'm just using camera as example, if it's a camera and it's pointing at them in the home, obviously some folks will have a problem with that. So you really need to explain to them what we're actually looking at and what we can't look at, equally importantly, so that they feel comfortable about this, because nobody actually likes to be monitored. I don't think, if you go up and you ask a bunch of people, hey, would you like to be monitored? I'm pretty sure they're going to say no, but it's the caregiver that really needs to make sure that they satisfy the person that you're taking care of in terms of the privacy angle is checked off. And then the other aspect is just in making sure that it's super reliable. The data's that the person is getting is accurate, because you're going to take actions on these pieces of data, right? So you're going to take an action if you're seeing something that might not look good, and you're going to take an action. If the data is not correct, and you start taking action on something that isn't correct, eventually you just lose trust in the data. And I think that becomes a problem at that point. And you may even lose trust in the company that's sort of providing that to you. And then there might be a form of churn where you don't want it. So you got to really address all these points very carefully. And I know for us, these things are probably top in terms of how we look at our roadmap, how we look at our product, how we sort of look at how we're going to commercialize it, is really to make sure that those foundational pieces are there so that we can move that forward with customers and they feel comfortable. But not only the customer, which is the caregiver in most cases, but also the person that you're sort of taking care of. They also have to feel very comfortable with whatever you're providing them. So there's a lot of things in there, but I think they all really matter at the end of the day.
Yeah, and the tricky part is communicating to different people, in their roles as end users, and also especially if it's going through a channel. So tricky,
Yes.
But I think everyone's evolving their approaches. We have a phenomenal amount of questions that have come in. So fantastic. Everyone's very excited to talk to you all. So I'm gonna take a few of these to work through them. One really hits head on a little bit of about what Mark was talking about when he said, man, if we have like 4 different point solutions, one is integrating that into some sort of experience, but also there's, how you all view these as competitive or complementary solutions. So I'd love to talk to that first. So one question said, please explore fall detection with ambient sensing. And will this replace medical alert PERS buttons in the near future? So not having fist fights here between the different people doing different things on the panel. But I mean, straight up, right, how do you guys see the fact that there are, when I shared earlier today, all of the different types of assisted solutions being used out there? Are they competitive? Are they complementary? Maybe Megan, I can start with you and then go to Eliza.
Yeah, I think it's a little bit of both. I think that, they can be at the same time, in a way, competitive and complementary. And, with us at Lifeguard, we've been experimenting with different ones for like our customers and our use cases, and they all offer their own pros and cons, so to speak. So, like example, like fall detection, it can be very powerful and very accurate in the areas that it's in. However, if you're trying to support someone in their own home, having to cover that entire home with that technology could be a little bit difficult, as an example. So I think it really depends on, what your end customer is really looking for. Are they looking, for example, immediate fall detection, or are they looking for more of a safety net that, kind of covers everywhere? And then, something maybe like a Wi-Fi sensing in what Cognitive offers is a better solution. So I think it's really just going back to like, what's the real, what is my customer looking for? How can I provide them the best value? And then just giving them and using the technologies that make the most sense for those use cases.
Got it. Eliza, do you want to share how you guys think about what your core business is, and then also where there are kind of new technologies on the market, how you evaluate those for maybe partnership, or whether to incorporate them, what's competitive, what's complementary?
Yeah, absolutely. So I think, we have a very large member base, and so people are coming to us for a wide variety of things. And so we are really attempting, to provide more of an ecosystem play where you're accessing all of those adjacent services through Medical Guardian. And so I think Mark's point was well taken. We see a lot of abrasion as sort of the difficulty level goes up or as the value goes down. And so our goal is to provide a variety of solutions, health, wellness, safety, engagement, and adherence through our devices and complementary solutions, but all through our own ecosystem. That's very important to us. We find that if we ask people to switch around to different apps, or if we ask them go here to get this or go here to get this, you just lose a lot of that. And so, being on person, mobile and at home is a unique opportunity that we have. And so, 80% of our solutions are mobile devices, smartwatches, neck, wrist. And so a lot of our members are on the go, at church, at pickleball, or, visiting with friends or for a walk. And so we need to make sure that they're protected throughout their, actual life and day to day. And so we're certainly open to partnerships, and we try to, like I said, segment pieces of our population to say, this is a really unmet need for this segment. And maybe there's some great solutions that work with this segment, and we're certainly open to partnering with them. But our initiative has really been to expand beyond the PERS devices that our members rely on, and provide them those extra value adds to stay healthy and stay well and stay connected and in their home. And then also on the caregiver side, we have, digital applications and a expansion of caregiver services that also provide them insights to how, their loved ones are doing in the home, or how people are feeling, and then, aggregating that data on a population basis for some of our larger government partnerships and things of that nature. So I think we're certainly open and see the value in adjacent technologies, but we're very focused on ensuring everything lives within our ecosystem in support of making sure our members feel like they are, getting the services beyond what they need to solve those additional needs for them from Medical Guardian at all times.
Got it. And Taj, maybe you can just weigh in quickly on where you guys see yourselves in the ecosystem as far as competitive or complementary, and then a shade of this question to Mark that also answers another question that's come in. So Taj, to you first.
Yeah. So I think for us, we look at a lot of these other devices as complementary, but Eliza and Mark, they said made a good point, right? It all has to come together into a single ecosystem for the end user, whether that's an app or a dashboard, however you're actually doing stuff for your customer. But as an example, like the PERS devices, they're great devices because you can actually leave the house and you can still monitor to make sure that person's okay. And then if you combine that with ambient sensing, then you get something in the home, but then they also have a PERS. So it actually ends up being a better overall solution when you start looking at taking this information and sort of combining it together. Not keeping the data separate, but actually fusing it together and then providing more insights with regards to what's actually happening with that individual. Because I know even some of the PERS watches and so forth, right? They count steps. They sort of give you an indication of activity. We also give activity inside the house. You can merge those pieces of information together, and you can provide more value going forward. Even, for example, a lot of people may not decide they want to have a PERS device when they're sleeping, but the ambient sensing is still working. It's taking to making sure that, hey, have you had too many interruptions at night? So we can sort of foster that nighttime behavior where the other device does something else. But at the end, they need to become together, as I was saying earlier, as a single ecosystem. You can't have multiple apps, as Eliza and Mark was sort of outlining, because it just confuses the individual that's either taking care of them or whatever. So it's really around taking it and fusing that data and providing more value back to the customer. So that's how we sort of look at these partnerships going forward. We really look at, does it provide more value when we sort of combine it together? And most of these things do normally do that.
Okay. All right, so a couple points there on the point solution versus integrated. So one comment saying there are a lot of great point solutions, but I don't see any company bringing it all together. And another comment saying in regards to Mark, mentioning adding multiple apps into one platform to solve data interoperability. Are any of you working on patient caregivers and dashboards? And sounds like we heard from Eliza, pulling multiple things in, but all within the same ecosystem. Mark, did you want to talk to that at all?
Sure, yeah, happy to. So this issue resulted in us at ECG about 5 years ago doing a little bit of a pivot and moving to develop an open platform. So we built our technology infrastructure to be an open platform that could integrate, other folks could integrate into, and we could easily integrate into other solutions as well as a step in that direction. I think other folks are doing that as well in terms of having platforms for integration. I think that's really, really important. It's kind of the challenge between, like we have on the phone business, you have Apple, a closed kind of garden, and then Android, which is kind of the Wild West, and everybody's out there, but then you have the integration issue. You then have some big players in that space, a Samsung and a Google, which are developing kind of their ecosystems as well. That'll probably play out in this space as well. We have to remember, though, we're probably in the second inning of a 9-inning baseball game, so it's still early, and it's in a market that's massively growing. So I think if folks realize the end game isn't what happens in 25 or 26, it's really where we in 35 and 40, 2020, 35 and 2040, that's what we really need to focus on. Because if we end up just, fiercely competing today for a same customer and overwhelm them with all of these point solutions, you'll just have people walk away and say, I'm not going to do this, or I'll try it and leave. And then recovering that as a company or as an industry gets hard.
So taking that longer point of view, Mark, which I think is fantastic point here. I mean, we're really building something here to change how we care for people and how people are cared for. You guys will not be surprised to hear that we have people asking about AI, okay, and these questions, and understanding how are you using AI today in your products. Also, more specifically, to what degree can AI assist differentiating client needs, or versus using people to kind of make some of those decisions and the safeguards around that. A couple other questions that kind of fold into that, but I'd love to do a kind of a quick round and maybe speak through to how you guys can talk about like how you're thinking about AI today. The market and technology is moving so quickly that when we talk about 2035, right, we're going to be in a very, very different place, but that work starts today. And so, Taj, maybe I'll start with you, and then I'll go to Megan, Eliza, and we'll end with Mark on AI thoughts. So, Taj, how are you guys thinking about it today? How are you using it?
So AI is always a conversational piece, even within cognitive. So just a little bit about our ambient sensing. We do use, I wouldn't say it's the big AI play, but we do use machine learning to actually figure out, when people are walking around and Wi-Fi gets interrupted, we do have machine learning algorithms, which is a form obviously of AI. So we've already incorporated a lot of that in there. But in terms of when you start looking at the data, and I think what becomes really interesting is taking the data trends that you're seeing with regards to a person. And the great thing about AI, it gets into, once it starts seeing data and you're feeding it data, it's very good at figuring out what direction the trends are going, even if they're slightly subtle. And I think you can definitely use AI in there. And I think there's a lot of discussions about using AI to sort of, for example, if you have a person that you're taking care of, maybe there's somebody that will call them. It may be an AI agent and just ask them a bunch of questions. Are you okay? Or for example, are you wearing your PERS device, or are you feeling okay because of whatever? And so calling in, I don't know how comfortable seniors will feel about that, or elders will feel about that type of interaction. I know, Mark, they have Addison, which is also a virtual care person. I don't know how the seniors feel about it, but I know there's a lot of movement in that area with a bunch of companies that are actually focused on building that out and using the existing large language models that are available today. So there's a lot of movement happening, and it's quite interesting to watch it as it's sort of progressing. But it is progressing fast.
We'll let Mark have the last word because of Addison. I'm sure he's chomping at the bit to tell us about it. You know, so Megan and then Eliza, if you could have a quick comment on how you're using AI.
Sure. We're really focused on obviously like efficiency in our operations. So we have, as I mentioned, a lot of like, human intervention. So using AI to make their jobs more efficient. But of course, as Taj says, one of the biggest things is, the trend analysis and, being able to suggest where things are going and maybe even eventually do, like risk prediction of saying, this client looks like they're at risk for this. But in our mind, it's, pairing that with like real, and there's like, for example, nurse oversight to be able to interpret, the AI, what the AI is giving you and give those real human-led recommendations.
Okay, great. Eliza?
Yeah, I would echo a lot of what everyone said. I think we focus very heavily on technology and innovation. So AI is, of course, a growing part of our business. I think we like to think of it in support of providing the best care is how AI should be used. I think there's data that certainly benefits from using AI to do more targeting and things like that. And I think there's also, we're using automations and AI to do more tactical, topical pieces of the business, because we still believe that the critical parts of our business need to be done by high touch, empathetic humans. And that is a limited resource these days. So as the caregiver crisis becomes larger, as this population grows, we need technology to intervene to do those low-hanging fruits, tactical pieces of our business, and really collect rich data insights so that the care that our teams provide of empathetic humans that cannot be replaced, they have the right tools to provide the right care at the right time for the right thing. And so that's how we're really investing and using AI to improve that human touch part of our business. And that's how I see that really unfolding.
Okay, Mark?
Yeah, great use cases. For us, we're using AI in two places, one on the back end with operations, similar to what Eliza was talking about. A good example is we have a team of care coordinators that look at data every day and then have outreach calls to seniors or patients over the course of the month. What we were able to do is use an ambient scribe, sentiment analysis, intelligent summarization, some AI tools, and go from having 5% of our calls go through a QA audit to 100% of our calls go through a QA audit for no additional cost and no additional staff burden. So all the folks that would do that additional QA work now are doing patient and client-facing work and really being able to focus on the job that they want to do, which is be care coordinators and help people aging in place. The other place we use it is on Edge through Addison. So Addison has incorporated ChatGPT. We're continuing to iterate Addison's conversation to be fully conversational before the end of this year. We put guardrails out there, so if anything starts going rogue, we'll just terminate the conversation, because the last thing we want to do is have a bad outcome because someone's getting told information or having a conversation they should not be having. And then the other thing we're looking to do is start integrating, like, for example, what the cognitive systems, motion sensors are telling us, feed that into our backend data engine too, and then have Addison be able to on-edge inquiry and probe and nudge a user to get additional sets of information based upon what we're seeing. So if we're not seeing activity in the kitchen, we can remind them of the importance of nutrition. If it's midday, hey, have you had lunch yet? Here's something you might want to do. And just stuff like that to be able to make the experience more personal and be able to make that data more accessible, real time, instead of us going looking at it after the fact.
Yeah, that's great. One quick follow-up that aligns with another audience question, then we'll close out here in just a minute. Question is whether or not there's a role for seniors or their caregivers to also provide, if there's flexibility in these models, to provide some proactive feedback. So can you tweak system parameters and say, oh, that's false alerting, or this isn't quite sensitive enough, or, you know, how do you think about, obviously being hands off is great, and that's the whole point of Ambient, that we're detecting these things, but can the end users also provide feedback to make the system smarter? Anybody want to chime in on that real quick, and then we'll do our last question.
Yeah, I mean, I'm happy to provide some context. I think one of the things I think generally is missed is that seniors and their caregivers want the same things that we all want in our daily life. And I think a lot of times we assume it's like more obscure than what we're looking for, but I think we're all looking for customization of our needs. Like who is taking the out of box anymore? We live in a world of customization and specificity and tailor it to me. And so I think it's really short-sighted to think that we don't need to provide that for these populations. It's a big miss, I think, when we segment them and don't, you know, understand the commonality of the need. So, you know, I think we absolutely have to take by person customization of what works for you. How often do you want to be engaged with? How comfortable are you with privacy in your life? And are we able to, you know, be in your home at a little bit of a higher level to make your caregivers feel comfortable, and really letting the person have the empowerment to make the solution work for them, I think is incredibly important. I think we need to listen to our members and give them the customization that all of us expect every day. And so I think we need to lean even more into that than ever and really allow for tailored solutions to tailored needs for the members. I think it's absolutely critical.
Okay, so Taj, I'm going to let you, thank you for taking that, Eliza. Taj, I'm going to let you have the final word here. Maybe just give us a final word on the outlook for ambient sensing specifically over the next year or two. What can we expect?
Yeah, so there's a lot, like I said, there's a lot going on, as I was mentioning earlier, with ambient sensing, just not, you know, just not with us, but with the ecosystem that's sort of being created with Wi-Fi. So I think what we're going to see over the next while with Wi-Fi is we're really going to focus on the data that it collects and really apply some AI learning to understanding what exactly is happening, especially around trends, to pull out those little details that you may miss with regards to how people are behaving. And I think just understanding like the simple things that are important, like how is the activity sort of going down? Are they not going to the kitchen? Are they not eating? Are they not going to the bathroom as often? And really highlighting these things and looking at multiple trend lines with regards to this. So not just one trend line like activity, but also inactivity. Look at things like where are they spending most of their time? Is that changing? And usually these things imply something. They usually imply that there is a problem. So taking what we expect, like some of that trending, how it sort of reveals itself as a potential problem, and highlighting that, hey, the activity is sort of going, this might be a problem because of this, and this reason, and providing sort of reasons so that you can reach out to the elder that you're taking care of and actually have a conversation with them with regards to, hey, are things going badly, and sort of try to be proactive about taking care of that, because proactive is actually one of the things that people are spending a fair bit of time on, and I think ambient sensing helps. Reactive is still important, because obviously if there's a problem, you need to take care of it instantaneously, whether that person fell or whatever it might be. So that's always there. But I think for us, we're really going to be focused more on the proactive. We do believe that if you had other devices that will help that will also integrate with our back-end data with regards to our ambient sensing. But there's a lot going on the ambient sensing side that will get better and better over time, simply because there's going to be more devices in your home that are going to be able to support it, because all these chipset vendors that are producing Wi-Fi are starting to implement the ability to sense. And the standard also makes the ecosystem grow. And as you get more devices that sort of support this, I can't imagine what we'll be seeing in the next 10 years with regards to what we will see with motion. There's a lot of people talking about using motion to even detect breathing. We have done that before to see if the person's breathing okay. And I think that's something that will start happening over the next five years, where there's going to be also microscopic motion sensing just beyond just the motion of a person, but actually picking up things like their breathing. Are they okay? I think that's how it's going to propagate going forward. So we see a lot of excitement in the industry for sensing. And like I said, it's just not us, it's the whole ecosystem that's now sort of supporting this going forward. So you're going to see a lot of interesting things happen over the next 5 years. And I can't even imagine how it's going to look like in 10 years.
Well, it's very exciting, and yeah, taking that longer time frame, it's incredible to think of how far we've come already and getting the foundation for a lot of these experiences in place. But that's all the time we have. So I wanted to thank our panelists so much. Thank you all very much for sharing your expertise, your insights, really what's happening out there in the market and what you all are seeing. Also to the audience for the killer questions. We didn't even get, we probably got to 60% of them maybe. So lots of great comments in here, lots of great questions. Hopefully we answered a little bit of what was on your mind. I'd also welcome you all back to our final conversation that we're hosting the Connected Health Summit series, which is in December, focused on healthy homes, sensors, and services, not just for the older adults, but for all of us trying to live more healthy lives in our homes and where we work and we live. Thank you again to Cognitive. We really appreciate your great support and for sponsoring this session. So thank you so much. And thank you all. Have a great rest of your day.
Thank you.
Thank you so much.
Thank you very much.
Thank you.